Okay, I'd like to welcome everyone to the fifth meeting of the Interim Joint Committee on Families and Children. Call this meeting to order, and I would ask that you please silence your phones. And the Secretary would please call the roll.
Senator Rocky Adams, Senator Chambers Armstrong, Senator Elkins, Senator Girdler, Senator Mays Bledsoe, Senator Meredith, Senator Tishner, Senator Webb, Senator Westerfield, Senator Wise, Representative Baker, Representative Kleins,
Here.
Representative Decker,
Present.
Representative Dietz, Representative Elliott, Representative Fleming, Representative Gooch, Representative Rayburn, Representative Raymond, Representative Riley, Representative Rorks,
Here.
Representative Stalker,
Present.
Representative Wilner,
Here.
Representative Wilson, Co-Chair Heverin,
Present.
Co-Chair Carroll.
Here. We do have a quorum and duly authorized to conduct business. First thing on the agenda, we need to approve the minutes from the September 25th, 24 meeting. Do I have a motion? We have a motion. We have a second. All those in favor, please signify by saying aye. Opposed, no. The minutes from the September 25th, 2024 meeting are approved as written. We have a lot to cover today. I'm going to move back to item number 7 on the agenda first to get this administrative reg out of the way. This is 922 KAR 001-350, emergency reg requirements for public child welfare agency, foster parents, adoptive parents, and respite care providers. Do any of the members have questions on this regulation? Seeing none, the referred administrative reg shall be considered reviewed by the committee. The first presentation on the agenda today is the Auditor Ball. The Auditor's Office is here and had asked for some time today to talk about kinship care. And as always, it is an honor to have you here today. Ma'am, please approach the table, bring your colleagues with you, and I would ask that you please introduce yourself for the record, and you have the floor, ma'am.
Thank you very much, Mr. Chair. I'm Allison Ball, Kentucky State Auditor. I have with me my General Counsel, Alex McGuire, and we appreciate the time this morning. Thank you very much for fitting us in. This today is going to be quick, and it's really just to inform you. I know that you've had a lot of discussion about the kinship care issue involving SB 151 and the implementation of that bill. So this really is, like I said, just informative, and it's to let you know that we've been aware and we've been watching and fully versed in what's happened up to this point. And then we also have Norma Hatfield, who's behind me. She's not going to be up at the table. I'm just letting you know that she's here. I know she's addressed this body before. And she came and she met with us and made an official complaint. So we have a lot of reasons to be involved in this issue. So we're letting you know that we are formally announcing today an inquiry, essentially a preliminary assessment, to determine whether the governor and the Cabinet for Health and Family Services can carry out Senate Bill 151. At this point, we are going to make all attempts to make this a collaborative effort with the governor and CHFS. But rest assured, we're going to do everything that we can to figure out the facts that you need to know and the facts that Kentucky needs to know, and so this can be implemented.
And Auditor Ball, I appreciate you stepping in with this, and I know it's been an issue that we've all had on our minds and very contentious issue at this point. So I think this will go a long way to getting this resolved. Ms. Hatfield, do you have any comments that you'd like to make?
I'm very grateful for the Auditor's Office in looking at this. I'm grateful for Senator Rocky Adams for being a champion for this bill. There are a lot of families, the longer we wait, that are missing opportunities for more long-term support that deserve it, and I'm just very grateful.
And we appreciate your advocacy on this issue, and not for you, I'm not sure a whole lot would be happening in this area, so we are very grateful for that. Senator Meredith, you have a question?
No, Mr. Chair, just a comment if I could. Just
want to acknowledge Ms. Hatfield's efforts over the years. She has fought this for so long and so hard. And I remember that the day you were on the Senate floor when this bill passed, how elated you were, we all were, that we had finally reached this point. And so sorry you're having to fight this battle again, but please be assured that we support you 1,000%. And whatever we need to do to address this, I guarantee you we will be available to you. But thank you for your fight. Thank you for your efforts, and greatly appreciated. Thank you. Thank you, Mr. Chair.
Senator Rocky Adams.
Thank you, Mr. Chairman. And I just want to echo Senator Meredith's sentiments. Thank you, Norma, for all of your advocacy. And I guess my question is to the auditor, and that is, first of all, I appreciate this. Like, this is wonderful that you have engaged, because I know how important these issues are to you as well. At this point, do you think that it will help to have any members of the legislature involved in some of these communications and how the bill unfolds? Or what do you think is the best route for us to take to make sure that we can get this across the finish line?
Yes, that's a great question. You know, I'm fully aware that I'm the executive branch and you are the legislative branch. So I welcome any and all input. I think we need to have good dialogue and communication between the two of us. At this point, this is just a preliminary assessment, and it's to get the actual facts so that way this issue can be resolved once and for all. Hopefully just implementing the bill that's already been passed, and this is done. But we're gonna do what needs to be done to figure out the actual facts in the situation.
Yeah. Who's that? It was right down there in the red. Stalker. I'm sorry, Representative Stalker. I'm still putting names with faces. I apologize.
No apology needed. Thank you so much. My question to you is twofold. Will you be including us, the legislators, and also I guess my question, and something that I have kind of already put to this committee, is will you be asking us to open up the budget? Because clearly we have the money, and if there was a miscommunication, which clearly there was somehow along the way, the question that I have posed is, are we willing to fund it? And I am 100% in support of funding this. This is incredibly important. It has already been stated about Norma's advocacy and how many years she has been at this, and I would like to see us as a body get this across the line. And so I just want to know, is that the request from you that we would open up the budget to fund this?
So it's early to say what the outcome will be. It may very well be that the money is already there. So what I need to do, my responsibility at this point is, like I said, it's a preliminary assessment. So it's not an official report at this point. And it will probably lead to an official report, official information for you all. So you can decide if anything needs to be done, and it may very well be that nothing more needs to be done. So that's where we're at this point. It's early stages. We just need to know what the actual, how much money is available, if there's federal dollars available, if there's discretionary money. We just need to do a review of this to figure out what the facts are.
Thank you.
Very good. Auditor Ball, staff, Ms. Hatfield, thank you all for being here, and I appreciate the efforts, and we look forward to this moving. Thank you very much.
Thank you very much.
Members of the committee, Originally, I had planned to do a meeting today to do a review over residential services for youth within our state, including mental health, substance abuse, and I did not realize that this would be the last meeting that I would chair, and so I changed to make this on early childhood education because I felt like we needed to get an update on what's going on since the end of the session, what's happening in the things that we did do during the session, what are the results of the things we didn't do during the session. And so I kind of changed course on all this, and I apologize because there was a member on the committee that I had told we were doing something different, but we will address that issue at some point and look closer at where we are within those facilities in the state, what services are available, where are we short, and so I do think that's a very important topic, and we will address that in the future. We're going to move on into the early childhood education component. Commissioner Dennis, Director Day, do you want to come forward, please? And again, the purpose is just to get an update on where we are in a lot of different areas, and then we'll have the Charles All with the Chamber will finish up today with some pretty exciting news that I think most of you all are aware of about something they've put together to kind of move us forward in this area. I have to say, after last session, I didn't know where to go, what would be next, and I'm pretty excited on what's about to happen and what that could result in. And I think it's a clear direction for our state. And I'm very grateful to the Chamber for the effort that they're putting in this issue, so it doesn't just go away, that we keep it at the forefront and keep moving forward. Ladies, if you would, please introduce yourselves for the record, and you have the floor. And again, thank you for being here.
Good afternoon. I am Lisa Dennis, the Commissioner of the Department for Community-Based Services.
And I'm Andrea Day, the Director for the Division of Child Care within the Department for Community-Based Services.
And thank you for the opportunity to be with you all this afternoon and share about child care. So when we think about what is child care, we often think about it as a simple definition of child care as being supervision and care of children when the parents or caregivers are unavailable, and that is true, but it is so much more. Child care is about early education, early learning, because we know that 90% of brain development occurs before the age of 5. So our child care providers are yes, they're providing supervision and care, but they're also part of that child's early learning and development.
Commissioner, can you move your microphone closer, please, so they can
Sorry.
pick you up? Thank you.
So again, child care is more that it's about, again, care and supervision, early child care development and education. It is also the workforce that supports our workforce. So child care also supports the economic health and well-being of the Commonwealth in addition to caring for our children. So real quick, we'll talk about, again, just a quick overview of the Division of Child Care. The Division of Child Care administers the Child Care and Development Block Grant. They also administer the CCAP program, the Child Care Assistance Program. And currently we are paying providers based on enrollment versus attendance. And we are also, we've also made the family copay has been capped at 7%. And the division promulgates regulations pertaining to child care, and we also partner with other state agencies to ensure children have access to quality care and education, facilitates the Child Care Advisory Council, and participates in the statewide Early Childhood Advisory Council to make recommendations regarding policy. So I am now going to turn it over to Andrea to share about the current state of child care.
So this is kind of just a broad general slide here. Capacity, before COVID, we were at about 166,000 slots. It was anticipated we could lose up to 40% of those slots. I'm happy to report that we've maintained that capacity. While the numbers alone don't show the growth, we have replaced anybody that has closed pretty much. So that is very positive. We also are hearing about workforce shortages, as I'm sure all of you are as well, and that early childhood educators, their wages are not comparable to other industries, and finding those qualified staff to work in those programs is difficult. This map was just completed by the University of Kentucky, HGI, Child Care Aware of Kentucky. This is a map of the current child care deserts across Kentucky. 50 counties, based on their analysis, are child care deserts. And that means that there's more than 3 children per available slot in that community. So this is updated from what you have seen in the past. We still have a lot of work, obviously, to do. Again, here are numbers showing you where we have been as far as the number of providers we have at the close of each year, and the capacity. Like I said, we're at 164,934 slots. Now, that is capacity. We all know that capacity and enrollment are 2 different things. We are working to get that true enrollment number thanks to an investment we made with ARPA dollars into the Brightwheel Child Care Management System. We know, if you don't care to go to the next slide, our CCAP participation rate. And as you can see, we did dip drastically, but we have rebounded. And I think that in large part is due to the investments that we made with ARPA dollars and that the General Assembly made in House Bill 6 this legislative session. Because prior to COVID, we were reimbursing our providers at the 40th percentile of the market rate survey. We increased that to the 80th percentile. We also made CCAP eligibility accessible to more families. Prior to COVID, the eligibility threshold was at 160% of the federal poverty guideline. We upped that to 200% and then upped it again to 85% of the state median income. So that makes a lot more families eligible to receive those federal dollars. And I will say that 85% state median income is that federal cap. So we are at the federal cap for federal dollars, allowing families to participate. One of the other things that we began doing, and we were the first in the nation that I'm aware of, child care employee income exclusion. We made child care employees that are working in a a licensed or certified child care program, as long as they're working 20 hours per week, they can have their entire household income excluded from the CCAP application. They are a protected population under the Child Care and Development Block Grant. The idea behind this was, and Dr. Vanover is going to talk about their recent survey and have some workforce data for you. Historically, child care employees are lucky if they make minimum wage to $10. If they received a benefit from or a scholarship from their provider, that was money that the provider was saying, okay, I'm going to invest this. But that was really a loss for providers. And so to recruit and retain staff that normally don't get benefits, we saw this as a recruitment and retention tool to help our providers be able to sustain and to attract more folks into a historically low-paying field. And as you can see here, at the end of September, 3,400 families are impacted by this, and that's almost 5,900 children are now benefiting from that. And those providers are able to use those funds that they would have offered a subsidy or a scholarship to actually invest in their programs to keep those doors open. We also provided transitional child care assistance to those families that exceeded the income guidelines at the recertification or at a case change. And so these are the families that exceed that 85% SMI. And initially we started out giving them 3 months support at 50% of their child care cost. But then we upped that to 6 months. And again, thank you to the legislature because in House Bill 6, again, you invested state dollars allowing us to continue this to give those families an easier access, to have 6 months to build in those child care costs into their monthly household incomes. The Employee Child Care Assistance Partnership Program, again, this is something that is innovative, and Representative Hebron, as a result of House Bill 499, we've done a lot of work on this. We were really one of the first states to do it on a statewide level and not start out regionally or in a city. We went all in. There was a lot we didn't know when we started this. We built this from scratch, but we did reach out to a lot of federal partners and agencies that had done it on a smaller scale so that we could learn the mistakes they made and we could avoid those hopefully and go into this knowing what to expect and what data we needed. It has been slow going, but I think that is giving us an opportunity to really make sure that we continue to educate the community as a whole and to shift the focus of how society as a whole thinks about childcare, because historically it's a family problem. But really and truly, it is an economic development and workforce issue, because we all know that if families don't have safe, dependable care for their children, they can't go to work. They're not focused on what they're doing. And so it's not just a family issue. It's a larger issue. And shifting that focus and shifting that mindset is where we are right now. And as you can see from these numbers, it is slow going. In the first year, we had 116 families, which constituted 160 children that were able to participate in this. And then so far in year 2, we've had 98 approved families and 135 children. I think this is promising in that this is October. The contracts went into effect starting in July. So we've had a greater interest this year, quicker than we did last year. We continue to partner with the Chamber, with economic development, with KDE. All of our partners are at the table talking about this. Our Family Child Care Network, Child Care Aware of Kentucky, and next slide, please. Child Care Aware of Kentucky has actually just developed a new resource that is available on their website that has an employer toolkit and an employee toolkit. And really, it's a one-pager that simplifies why it's important for the business community to think about childcare and their role in this. This just was released last week, so I'm very excited to be able to share that with you guys. But that was kind of a broad overview to say, pretty much, the investments made have allowed us to sustain. And while we're not where we need to be, we have made a lot of improvements to allow providers to keep their doors open and providing the critical care that they do. One thing I do want to touch on really quick that I mentioned earlier is we were reimbursing providers at the 80th percentile of the past market rate. We did do a new market rate study this year. Looking at those numbers now, we are currently reimbursing at the 75th percentile for all age groups and type of care, with the exception of 2 that are a little below. Our Division of Administration and Financial Management are currently working through that state maximum rate for the provider reimbursement to see what that number is to move us from 75th back up to 80. So I do want you to be aware of that, and that is work that we are doing, and hopefully we'll have an answer soon.
Okay, Andrea, thank you. Going back to the ECAP, year 1 compared to year 2, the 98 in year 2, those are all brand new families?
I don't know that they're all brand new. There could be some that have continued on, because obviously those folks got first dibs, if you will, if we get to the point of having a wait list. Those existing employers are allowed to apply in April, whereas all new apply in May.
I see.
So it could be a combination.
And do you all, how many are many of those the same employer, or how many employers do you have participating right now? Do you have that number?
I think it was, we were up to almost 50, but I will get that number for you.
So of all,
and I do have the list broken down by county, and I apologize for not having that with me.
Okay, and then I think I sent you a message on this. I received word that there was a particular provider that they had a parent who was coming in after hours they worked a job during the day. They came in after hours at the child care facility, put in the minimum number of hours to be eligible for CCAP, but provided no services, direct services for the kids, not even there when the center was open. And under the regulations, my understanding is that's allowable. And thoughts on whether or not we need to tighten that up?
So with the regulation language, you are correct. It does say that as long as they meet technical CCAP eligibility. We have updated the policy surrounding that and have put in a change request to make the necessary change to the system to make sure that those hours of employment are tied to direct child care and not the other. That was an unintended loophole that was created.
And I understand, because you could have those that aren't teachers that are there during the day, like a custodian or something, that they would be eligible. And I'm not sure I have a problem with that. It's the after hours is where I think the issue would be. The updates that you all are doing, will it account for just those after hours, or will it eliminate those during the day that aren't actually in a classroom?
It would eliminate the those that are only working, let's say, 10 hours from that 4 to 6, like you mentioned, coming in to clean classrooms or make copies or do whatever. That would only be 10 hours, let's say, a week that they were in the child care, not what their full-time job was. So this would not have unintended consequences for the cook at your child care or the janitor or things like that are actually working at least 20 hours in that child care program.
Okay. And I have to admit, that's pretty creative, but not the intent
Correct.
of that whatsoever. So
that was not the intent. And as soon as we received that message, we worked very quickly to close it.
When I got the message, I was, no, that can't be happening. And it was happening. So it is creative. I'll stop now and let others ask questions. Co-Chair Heverin.
Thank you, Co-Chair. Thank you all for the presentation. I think one of the big things that we see an increase in numbers this year is because we made it permanent in statute. It makes the employers a little less frantic. And so I totally understand that. I'm thankful we were able to get that through. 2 questions, if you will indulge me. Co-Chair, I'll be quick. First off, I know I'd had a member, and I think she's actually signed up to speak, so she may mention it too. There was a group, there was a employer that filled out paperwork, the physical paperwork, and they submitted it, and then the office said they could not submit that. They needed to do it online. And so have you all removed the paper copy from the website?
So we have, because in year 1, we did everything manually.
Yeah.
And some of the feedback that we got, because we would accept it by mail, fax, or email. The biggest concern there that we heard was that's not secure at all, because there is private information in there. And so we worked very hard with our development team to put that online. And that way it's a smoother flow of communication, and it's quicker.
Yeah.
And again, there's the accountability to say, this is when it was submitted, this is when you got your response. So it gives that clear outline of what has happened in that case that is clearly documented. So that is something that we did do just for safeguards.
Yeah.
For both the employees and the employers.
Yeah. Thank you. And then my next one is, do you all feel that you all have the capacity to continue to do this, or do you think a third-party administrator would be more helpful just to make sure to get the word out and just have more capacity?
So I will say that when we switched from paying our CCAP clients based on enrollment, not attendance, that did free up our payments team. So we repurposed some folks there. Currently, yes, we have capacity, but if this takes off like we all want it to and becomes bigger, that administrative lift may look differently. But we won't know till we get there. I would like to say, yes, I would like to hire 3 more staff, but if we don't have the work at this moment to justify that, there's other areas that definitely need that more. There are a number of companies that do similar work. I think having it within the cabinet is beneficial because our payments, especially with CCAP, are automatic payments through our KICS system. So it removes an added hand in the pot, if you will. But again, I think we need to be very mindful as we move forward and keep a close finger on that pulse of where we are and what we can do as this grows.
Thank you. I appreciate it. And I would love to see the list of counties that participate. If you could send that over to the committee.
Yes, ma'am.
Thank you.
And Andrea or Lisa, whichever one, the programs that we funded in the budget, and I know a lot of those were not to the level that we really anticipated that we would need to fund throughout the 2 years, the biennial budget. My understanding is that there will be enough funding there to continue all of these programs through the 2 years, correct?
That is it.
Yeah. Okay. Good. Representative Decker.
Yes, thank you, and thank you for the presentation. So I am that representative who had a constituent, in fact, I've had two now, who talked about being denied coverage. They are people who weren't in it in the first year. One of them submitted the exact same information on a website that said it could be accepted and sent in by mail. So the website was still up and running. The mother did everything required in that website, and it was denied because there was a separate website set up that required the portal. And since it hadn't been done by the second website, the first documentation, all the same as before, was denied. By the time that was all figured out, she missed the deadline. She contacted you all. In fact, I opened a constituent services, and it was denied because the portal wasn't used. The portal is not in the statute. There are specific reasons in the statute for termination of contracts. That's not one of them. So I'm just curious. I see this is so far, and there are pending cases, but hers was denied. So can you just, in general, was that the only person in the state? Because others have told me they've missed deadlines that
No.
weren't.
So
Okay.
while there are deadlines established, because we're not at full capacity and full usage, they can still apply now. And if memory serves me correctly, let me just own this, that yes, we left the information on our website that was an oversight that should have been taken down and did lead to that confusion. So for that, I do apologize, and we have since taken that down to change that. And notices were sent out to those employers participating, because one of the things about this program is the employer has to initiate that application, not necessarily the employee. So the employer has to actually start that process. But again, I'll be happy to look into that again. But to my memory, it was the employee had tried to apply without the employer on board to initiate that.
Yeah, in that case, and that's just one case,
Right.
but the employer had filled out all the documentation. It was sent in as it was the year before. But
Representative Decker, if you'll send that to us, we'll look into it
Thank
again
you.
and get back with you.
Thank you.
Yes.
But I'm just wondering, I don't see that the numbers have gone up. I see, this looks to me like they've gone down. And I'm curious, why do you think we would drop in the number of applicants when it was something that gave financial advantage to? Why are there fewer children and fewer families? Is it the application changing, or what is it that has caused our families not to be applying and not as many children?
It could be a couple of things. These numbers so far are just from July until today, current. The numbers from year one was for that entire state fiscal year. So while the number is lower, we still have 8 more months. And so we're hoping that more folks will continue to apply. We did hear feedback that switching to the portal did cause some confusion. And we did build in some notifications, but I think it didn't go as smoothly as we had hoped. And so, again, we are working behind the scenes with the developers to make sure that we learn from those mistakes and we make this program better and more accessible.
I hope so, too. And one more question, I'm sorry. I should have asked that before. So are the people who missed the deadlines, because I've heard from others, have they all been contacted to know that they could still apply?
I will double check that, but yes, they should.
Thank you very much.
Andrea, in looking at slides 9 and 10, looking at it on 9 with the denied ineligible employer, and I noticed there were 94 year one and 0 so far this year. What does that mean? What would make an employer ineligible?
We had a lot of folks, we do the child care income exclusion provision. We had a lot of child care providers who weren't using that, and then they applied to be part of ECAP. And so what we said was, have your staff apply for CCAP because they are a protected population. That is a greater benefit to the employee and to that provider, because again, that provider's not having to make that contribution that we then match. They get a greater benefit in the CCAP world than they do in ECAP. So we're trying to make sure, again, these are two very separate programs, two very different pots of money. So if when we get an application and we see that a family is below 85% SMI, we refer them to CCAP because they're going to get a greater benefit. So that is something that again, we've worked very hard on our communication and outreach to remind providers that the employees are a protected population.
So they wanted to partner with the state to pay for their
employees,
but those employees were not taking advantage of the CCAP.
Correct.
Okay. Again, I guess trying to be creative. Good. And then do you mind just so where it says denied CCAP, those are obviously, those were applicants that were on CCAP. Non-contribution, I guess the employer was not making the contribution.
That went through the process and then put 0 for contribution.
Okay, and documentation pending. Okay. All right. Senator Chambers Armstrong.
Thank you, Mr. Chair. Thank you all for being with us. I had some questions about your license capacity. I'm curious if we know what percentage or what the numbers of those license capacity that are 3 quality stars or above, and if we have a map looking at sort of childcare deserts around 3 stars or above, because again, we're talking both about access to childcare, but also that high quality childcare. I'm also wondering if you can talk to us about resources that are available to providers if they are in that 1 or 2 star level and they're looking to improve their quality. And finally, the last thing I'm curious in while we're talking about license capacity is if we know the percentage or the number of these license capacity spots that serve alternative schedules, folks like our police officers or firefighters who are working 2nd shift, 3rd shift. Do we have any data about that and where those spots might be concentrated? I know that's a lot of questions, and I appreciate your answers.
So, quality. Currently, 35% of all regulated programs across the state are considered high quality, which is level 3, 4, and 5. We have seen a dip since COVID. We were up to the 45%, and that has gone down because providers are really focused on keeping their doors open and not necessarily investing in quality. All of our providers do have access to quality coaches, health and safety coaches. There's a tremendous amount of technical assistance that's available, as well as professional development opportunities. But that is something that is one of our priorities. And this year, next, and forward, obviously, is how do we look at All-Stars in a different way? That regulation will be open next year because it's at that 7-year mark. And that's a question that I also have is how can we motivate those 1s and 2s and change the way they may think about investing in quality and support them to achieve higher levels, because there's incentives and add-on payments that they get the higher levels that they go. And ultimately, that just supports our kids all around better. So that is a priority for us. And that is something that we've been keeping a close eye on. As far as the non-traditional hours, I'll have to get that information back to you.
Thank you very much. And I think all of us would be really interested in knowing what the ideas are around how we can improve those quality ratings, because hearing that 2 out of 3 kids are going to programs that aren't considered high quality just really makes me concerned from a, we want to make sure we're supporting our kids from an early age and not creating disparities in terms of the learning environments they're in. So I appreciate your all's work, and I look forward to continuing the conversation. Thank you, Mr. Chair.
And I think it's important to remember that's one of the reasons that we looked at perhaps funding childcare. And for a lot of these centers, it's just a matter of survival, and so it is hard to focus on quality to any level, just other than getting by. And we've got to that's the first hurdle we've got to get past. The incentives, and I can tell from experience, we just went from a 4-star to a 5-star, and there is a significant difference in the amount of stars money that you receive. In addition, because of the increased child care assistance numbers, that also makes that number go up. So if we can get these centers to where they can sustain and start focusing on quality, there is more incentive the better quality they provide. So it's just, I think it's a step-by-step thing, and that's where we do need to start. But getting the idea through some members of this legislature that you're supplementing a private industry, that I think we have many that just refuse to really study the business model and know that you're limited. You can't just bring in more kids. You can't continue to raise rates, because we'll see what's happening is, as a result of that, we're seeing mothers quitting their work to stay home with their kids because they can't afford the high rates. So that's the dilemma. Senator Rocky Adams.
Thank you, Mr. Chairman. At the end of your testimony, you said that we are not where we need to be. What do you mean specifically with that comment?
Well, that's my own personal opinion. As far as a whole, we're not where we need to be as far as how we think about child care. And I think I've shared before this committee before I had kids, I was a little arrogant. I was like, it's just child care. How hard can that be? But then once you become a parent and you are utilizing those services, it is so much more, like the commissioner was saying in the opening, it is early childhood education. The foundation is started so early, and that brain development 90% before the age of 5. I think, and Senator Carroll and Representative Raymond, we were at a conference talking about investing in child care, and another state shared that they invest $32,000 a year to house a prisoner, and they invest $2,300 a year per pupil. And how just the idea of, if we rethought our investments and where we put those fundings, could make a big difference. And when you talk about the whole early childhood landscape, there's 3 very different bodies that are over that. And how can we align ourselves better to serve more kids and provide continuity of care for those children, as well as concrete supports to families? Because when we have safe children, safe families, and safe communities is when we really flourish. And I know that sounds very ideological, but I mean, to me, that's what I want so much more. There's so much potential in this space for collaboration, for a lot of things, and we're getting there slowly. And it's going to take us some time, but I think we need to keep that at our forefront and not lose sight of what we need to accomplish.
Yeah. And Mr. Chairman, may I have one comment?
Yes, ma'am.
And I agree with you. I look at your slides and what they mean, and it's almost like, where do we start? Do we start with the deserts? Do we start with the money? Do we start with the numbers? Do we start with engaging the business community? It's one of those issues where, as legislators, we think, where do we start? And I don't know if we start a little bit in a lot of places or in one place specifically. So, any guidance I think that you can give to us on policy and funding is really critical at this juncture, because it's a workforce issue. And so I appreciate your comment, and I know that the members on this committee are really committed to seeing progress made, because it's important for our families. So thank you. Thank you, Mr. Chairman.
from that conference, and it's something we talked about a lot while we were there, and we heard from many other states, where a lot of states are starting, they're putting all things children under one umbrella. So basically a cabinet for children. And they are making our kids a priority at the level of other issues in this state. So if we really wanted to be serious about this, that's exactly where we would start. In all these different fragments of things dealing with early childhood within state government, bring it all in. Bring all the funding in, set the priorities, and I think we could be so much more effective if we would do that. And that's big thinking. But Senator, you talk about first steps. That's what the trend is across the country right now. And those states that are doing that, it's working, and it's making a statement on the importance of our kids. And so that's got to be the first step, that we make that the priority. We don't just talk the talk, we walk the walk, and establish it in such a manner, and then really get serious about it. So, but that was a great conference and picked up a lot of good things there while we were there. Any other questions from members? That is Representative Elliott.
Thank you, Mr. Chairman. And I'm one of the skeptics that government should be completely funding child care, and I do appreciate the comments of the chair. I think he's very
if
passionate.
you don't mind, I would like to show you the financials from my center one day.
I'm willing to look at those.
Six-figure loss.
Yeah, I understand. But I'm one of the skeptics. I did want to know if you've done a national survey of what states have done around the country in terms of how they funded private child care and what the results are. It sounds like the chairman has some research that I need to look at. But have you done that at all?
So the information that I've really relied on is how do other states do it? But, I don't want to say my primary focus, but, we're very concerned about the CCAP population. And whatever we do there, we have to be very mindful, because any huge increase or change is going to directly affect families that don't qualify for any assistance. As Senator Carroll mentioned earlier, about 20% of our slots across the state go just to CCAP kids. So the other 80%, those are all private pay families that get no assistance whatsoever. And so I think there's that very fine line of, do we turn everything up to 11, so to speak, because the majority of that is going to really fall on our 80% that don't receive any kind of assistance. So it's a balance, and other states have different funding streams and different revenue sources. So
New Mexico, I remember them being kind of a lot. Don't they have a set funding stream?
They do, that their governor and their state legislature have invested, and I think their CCAP eligibility is at 325% of the federal poverty level. So that's all covered. Vermont's is at 575% of the federal poverty level. But again, those states are very different to how we're made up. And again, it becomes, I think, what do we invest in, and how do we decide to use those dollars?
Representative Elliott, is that?
That's all I have, Mr. Chairman.
Okay.
I appreciate your time.
Thank you. Any other questions? Okay. Thank you both for being here. I appreciate all the work that you do. Next, we're going to have Dr. Vanover and Kristen Collins with the Foundation for Appalachian Kentucky. And Sarah, Dr. Vanover may be able to shed some light on some of the issues we just spoke about, what's happening in other states too. Please introduce yourselves for the record, and you have the floor.
Hello, I'm Sarah Vanover. I am with Kentucky Youth Advocates, a Policy and Research Director.
I'm Kristen Walker-Collins, the CEO at the Foundation for Appalachian Kentucky.
So we are here today to give you a slightly different perspective on the state of child care. Division of Child Care and the Cabinet brought forth numbers, enrollment, the things that they do best. Well, first of all, I'm with Kentucky Youth Advocates, and I'd like to tell you that our organization is really a independent voice. We are looking at what benefits our kids, and early childhood education is a big portion of that because, again, like Andrea said, that 90% of brain development that happens 0 to 5, and the way that we want to make sure that early childhood education is connected to overall health, family supports, and our partners in Eastern Kentucky also work very hard for many of those same goals. So as Andrea mentioned in her presentation, some of the major challenges that we're seeing in the child care sector include the child care workforce, financial stability of our child care programs, and the cost for families. Andrea said that capacity in the child care workforce were the kind of the top two things that we're hearing, and those are so significantly linked. When there is not workforce, it diminishes the center's capacity to care for children, their overall enrollment ability. A center may be licensed to hold 150 children, but if they're missing 3 staff members, then that means that 1 to 2 classrooms could be closed down, and that automatically can reduce their capacity by 40 children, meaning that 40 families in the workforce have to find a different way for their child to be healthy and safe during the day while they go to work. And in many cases, an adult in that family will decide that if I have to choose between working or making sure that my child is healthy and safe during the day, they're going to choose their child every time. And so as we look at how to financially stabilize child care programs, how to manage costs for families, the workforce is really at the center of that. So recently, both the University of Kentucky came out with a new cost of care and workforce study focusing on Kentucky, and the Center for the Study of Child Care Employment, which is a national organization that just studies the early childhood workforce, came out with a nationwide workforce index and focused on Kentucky along with every other individual state. We found that Kentucky is in the bottom 13 states, and that our child care wages are at least 25 to 30% below the living wage that is required within the state. Now, UK, I made a boo-boo on this slide, so I apologize. It says average wages. These are actually the median wages. So you have to think that if the median is for a director to make $20.10 an hour for a total of about $41,000 a year, then we have a lot of people that are not up to the median, particularly when we think about our teachers, because many of our teachers in the field are entry level, they're new. A lot of people decide to go into childcare thinking, I love kids and I want to spend all day with them. But being one of 2 adults in a room of 22-year-olds is not for everybody. So we have a lot of childcare employees that teach for a couple of years and then think, man, it would be nice to find an easier job. Many of them never make it to the median level of pay. But this is what we're looking at as far as UK's most recent research in Kentucky. Median would be for a director to make around the 41,000 mark. Now that means that that director is the manager, the highest paid employee there. They often spend their days in the classroom and work overtime to do their paperwork because they don't have enough staff to cover the classrooms. Education coordinators, not every center is able to have an education coordinator or an assistant director, but in many cases this is the person who coaches the teachers and helps them become the best they can be in order to care for the children. Teachers, around $29,000, $13.97. The average pay last year in Kentucky was $12.39 per year for a Kentucky teacher in a child care program. Median, this is a little bit higher. We have teachers making up to that area. We still want to see that number increase significantly. And assistant teachers. Now, not every program has assistant teachers. Some have co-teachers. Some have a lead teacher and assistant teacher, depending on their structure. But our assistant teachers, again, are making slightly less than our lead teachers at around $13 an hour. So the child care workforce and how well we are doing is rated on some major indicators, according to the national office. Teacher qualifications and education supports are part of that. Now, this doesn't mean that everybody has to have a 4-year degree, but are we training them to feel safe doing their job? Do teachers understand the kids they're working with, the disabilities that children may have in the classroom, how to work in a group setting? A lot of people babysit a child one-on-one and feel very confident. But again, when you're in a room with multiple young children, how do you maintain a balance there and protect everybody's health and safety as well as their education? This is a big one, work environment. Do they have paid time off? Can I be sick for a day and not worry about whether or not I can pay my bills? Do I have paid planning time? We recently had a dissertation completed here in the state of Kentucky, a master's dissertation, on whether or not paid planning time reduces stress, helps teachers to feel more prepared. Most teachers do their planning time at home, and that goes for early childhood all the way through our K through 12 system. And so we kind of abuse their paid hours, and they work much more than a 40-hour work week. Salary schedule, benefits. Many of our child care providers in Kentucky do not have health insurance because they work for very small businesses who don't have the ability to offer health insurance at a reasonable rate. Again, compensation and relief packages is parity with public school. If you work in a child care program teaching 4-year-olds and someone else is teaching pre-K in the public school system, there is a significant pay difference, almost $30,000 a year. Workforce data, we have great data collected through our ECE-TRIS professional development system, but there are data holes that we're still working on in Kentucky, like tracking enrollment instead of capacity. And then financial resources. This is the one point that the National Center gave us a boost on this year. They said we were making progress because of the enormous amount of state funds that we contributed to for the first time, thanks to you all. And previously we had been a state that really just relied on the child care development funds given through the block grant. And for the first time, Kentucky really made a substantial investment in our state dollars. And so we got ranked up on this one out of the 5. Woo! So other things that are important to keep in mind. Just when you look at the demographics, 98% of our child care workforce is women. Now, of those, there's 2 main areas that we see, center-based and home-based. In center-based care, we have 76% of our teachers are between the ages of 49 and under. Now, the program that offers free child care to child care providers, this is why we're having a big boom in the centers, is because many of our child care employees are at an age where they have young children, and it is a huge draw to them to have that cost offset, to be in the same center with them, to get to see their children while they bring home a paycheck. And then we also have about 24% that are veteran staff that have been doing this a long time and that are setting great teaching examples for our new teachers coming into the field. Now, in home-based staff, I want you to look at the number of providers 29 and under. It's 4%. A lot of that has to do with housing. Many of our 29 and under population does not have a home that is reliable, that's their own. Their landlord may not allow them to watch children in their care. Unfortunately, when we have that shortage there, then we're not feeding new home-based providers into this field. They don't grow up caring and creating those home-based facilities, and that's where we have a shortage in a lot of the rural areas. So KYA did an extensive survey of both child care directors, owners, and of parents during the month of September. We kept the survey open from September 1st to 30th. We had 439 child care directors that participated in the survey. That is great participation out of the 1,984 child care programs that were open at that point in time. We also had a great deal of parents participate. But I want to share with you the results from the directors first. So the vast majority of the participants were in centers because that's the vast majority of where our care is. And we had more participation in rural than we did in urban areas, which is also fabulous because we want to see both of those voices present. This is something that Andrea made reference to. We used to have a 45% high quality rating in our child care programs, and that has dropped. That has a lot to do with adult-to-child ratio. Adult-to-child ratio is the #1 indicator of safety in child care facilities. Kentucky has some of the lowest quality ratios in the United States, particularly our 2-year-old classrooms. That ratio is 1 adult to 10 2-year-olds. I have been that adult before, and I don't ever want to be that adult again. Caring for 10 2-year-olds by yourself is very overwhelming. But right now, in order to stay open, 72.4% of our programs are operating at the maximum ratio in order to keep their doors open. And many of them previously had lower ratios that allowed for higher quality, that met with accreditations that were higher. And a lot of programs have had to drop that in order to maintain their business. Other things, right now 70% of child care programs have wait lists. That means that a lot of families are trying to find child care that might not be accessible to them. Now, we asked everybody to answer these questions based on the past 12 months and only the past 12 months. 75% of child care programs have had to do a tuition increase in the past 12 months. 57% are fully staffed. That number is up about 20% from 2 years ago. As far as fully staffed goes, and a lot of that I will contribute to the free child care for child care providers. But low wages are still an issue there that prevents centers from having all the staff they need. 57% of the programs said they had families withdraw due to the tuition increase that they could not afford. And what the feedback we got from directors was, my families on subsidy stayed. My middle-class families who didn't qualify for subsidy were the ones who had to withdraw, and a parent decided to stay home. But because I had a wait list, a more affluent family came in and took that spot. So we see families with a high income that are getting the child care they need. We see families that are getting support if they're a lower income family, but our middle class families are struggling to obtain the child care that they need in order to work. This is another point that I really wanted to bring out. Children are expelled from child care programs more than 3 times the rate of the K through 12 system. Now, a lot of that has to do with the fact that these are small businesses and they can make independent decisions, and we want them to have their own personal touch on their program. However, the biggest part is that they don't have additional resources for children with challenging behaviors. The public school system has special education funding. Child care does not. We asked programs to be honest and tell us how many of them had to expel a child due to challenging behaviors, particularly those related to disabilities, within the past 12 months. 53.5% said they had. That was 234. Now, this is less than 20% of the child care programs in the state. So think of 234 preschoolers being expelled and multiply that by a little bit more than 4. And we have children that are being expelled from child care because of disability-related conditions, and the teachers don't have the training or the funding to support them the way that they need to, especially if they're operating at the maximum ratio, adult-to-child ratio, that they can have in their program. I know that many of you usually see me standing in front of you as Sarah, the early childhood specialist, but I also want you to know that today I'm coming to you as Sarah, the special needs mom of a child with autism. And my children are in middle school now. I still can't find a babysitter who feels comfortable watching a child with autism. But think of full-time child care that you need, because as a special needs parent, you have more medical bills. You have to have health insurance. You have multiple therapies. You are already worried about your child so much every day. Are they safe? Are they healthy? And then you have centers that are expelling them. And these are programs that said at least one. We also had parents report that their child had been kicked out of multiple programs because the staff didn't know how to support their disability. However, nearly 3 out of 4 directors, 72%, said that if their staff had more training, more staff, that they could serve children with disabilities. So if they were fully staffed and their staff were trained on how to work with children with disabilities, that they would be able to support more children. Right now, every child care employee in the state of Kentucky that works with children has to have 15 hours of training per year. But what that training is about is not designated. And we have many child care providers that take 15 hours of art training and take the exact same trainings every single year, instead of learning about how to support children with special needs, with mental health needs, with chronic health care needs. And it's something that directors are telling us, if we had more of it, then I could support these children in my program. On the parent side, we had 455 parents participating, representing 50 counties. And nearly 1 out of 4 Kentucky parents in urban and rural areas said they're looking for childcare now. So parents rely on childcare so much. I broke this down by urban, all of Kentucky, and rural, just so you could kind of see that everybody's kind of right there in the same situation. Parents who need childcare to work. Overall, 98% of parents in Kentucky that responded said that they need childcare in order to work and be a part of the economic development in their community. Parents who had difficulty finding care, 60%. And because of those childcare deserts, that's one thing, but also even in areas like if you look at Jefferson County as a whole, it's not a childcare desert, but there are parts of Jefferson County that are deserts, and there's nowhere close to where the family lives to find childcare, and the same in a lot of our urban areas. And then in rural areas, we have counties in Kentucky that do not have a child care program whatsoever, or they do not have infant care at all because the child care program there has dropped infant and toddler care in order to be more financially stable. So these are things parents told us in the past 12 months. 46% of parents missed at least 3 days of work due to a lack of child care. 37% of parents reduced their work hours due to child care concerns. And 30% had to temporarily leave the workforce due to child care concerns. And we've seen things as simple as an after-school program at an elementary school had to close for 3 weeks until they could hire more staff. And then all of a sudden you have parents whose workday has to be done at 2:45 p.m. Actually has to be done before that because they have to be there at 2:45 p.m. And I can tell you as one of the parents that's happened to in the past couple of years, nobody else's workday ends at 2:45. It is really hard to rearrange your life for that. But it could be that a child from 0 to 5 all of a sudden lost child care temporarily, and you have to attempt to work with a 2-year-old. Now, working remote is fabulous. It gives us a lot of freedom, but it is impossible to work remotely and give your full time and effort to your work when you have a 2-year-old running around the house. I tried during the pandemic to do that with a 5 and 7-year-old, and people were jumping off furniture while I was on meetings. And so thinking about the health and safety of a young child who isn't supervised is a huge concern. The other thing I want to point out is that 1 in 10 parents told us that they have a child in their home with a disability. We asked parents if centers had resources to support them or if they knew of resources to support them, and 88% of parents said no, that their center did not know how to support a child with a disability. And that led to expulsion, or that led to the parent having to leave the workforce because our teachers aren't trained on how to support kids with these individualized needs. These are some of the statements that we got from the survey. Middle-class families have withdrawn due to cost, but more affluent families are taking their spots. Keeping staff who are overwhelmed with classroom stress has led to dismissing more children with behavioral concerns. Teachers need the staff. They can't give them up, but if they have a wait list, they will dismiss a child with behavioral concerns because they can fill the child's spot. They can't fill the teacher's spot. And then finding staff has been more of a problem than enrollment. So I'm going to turn the floor over to my colleague, Kristen. Her organization represents the counties that are highlighted on the map.
Thank you. Thank you all so much for having me here today. As Sarah said, I'm with the Foundation for Appalachian Kentucky. We are a nationally accredited community foundation located in and serving the coal fields of Appalachia. Our headquarters is in Hazard and Perry County. But you can see these are the counties that we currently have affiliates in. We actually serve all 54 ARC designated counties in Kentucky. But this is where we mostly focus here on this map. And my role here today is to help give kind of an overview of what's happening in one of the rural parts of the state, and kind of what we're seeing where we are. And you may wonder why a community foundation is involved in childcare. And I will tell you that in 2016, one of the largest childcare centers in Perry County closed down unexpectedly. And the Foundation for Appalachian Kentucky, was approached by the board and some of the staff to help them figure out what to do next. And that led us into a 3.5-year management contract of managing a child care center in Eastern Kentucky. I will say that through a lot of hard work from the board and the staff and the parents, that center was able to reopen 6 months after it closed. And in 2020, was able to go under it, was able to be self-contained and no longer managed by our organization. As a result of that, however, we saw a need. We, the Community Foundation, had seen another center close in our community as well during that time period, and had noticed a statewide decrease in family child care homes. So we helped create and form the Appalachian Early Child Care Network that is led by Becky Stacy, who is doing wonderful work here. And in full transparency, I am the board chair of that organization, but they are doing important work around increasing family child care homes in Eastern Kentucky. And just to give you a little bit of information on that, there are currently 47 family child care homes in our region, with 4 that have just received the state grant to open and to become certified. And they are seeing an uptick in people interested in opening family child care homes. I will also say that a lot of the data that Sarah shared today is also true where we are. I have 2 daughters. They attend or have attended childcare, and and the center where they go is one of the largest in Eastern Kentucky. It's licensed for 141 children, which might not seem huge, but where we are, it is. And the business model doesn't work. It's too big, and so that is why the focus on family child care homes has become so important. But according to the director, she has a wait list of over 100 children waiting to get into the center. There are 4 child care centers in Perry County, and if you saw the map earlier that Lisa and Andrea showed, you saw that a lot of counties in Eastern Kentucky don't have child care at all. Knott County. Letcher County has 1. Floyd County has 2. So we're not talking big numbers of child care centers, and we're not talking large capacity child care centers either. Also, the fact that of the 4 child care centers in Perry County, the center I spoke to recently, their starting pay is $10 an hour. They were asked this summer by the other 3 centers to lower their starting pay to $8.25 because they could not compete with that. That center did decide to stay at $10 an hour, but the tuition that is brought in does not cover payroll, and that does not even count utilities, mortgage, insurance that's required. We are doing a lot of searching for grants. Additionally, they need additional training for teachers. They are seeing an uptick in students with IEPs and undiagnosed behavioral issues. And the child care director is spending most of her time in the classroom with the teacher instead of doing her administrative work. So she texted me last night. I just sent her some questions, and she said, "I'm so sorry that this is so long." She said, "But it's so upsetting. I'm sitting at Walmart on the bench just typing this because I need to get it off my chest." And she is also reporting that she has parents that are weighing removing their children from the center because they can't afford it anymore. The biggest barriers that we see for childcare is the availability and the affordability. So this is all stuff you all have heard before. It is just a lot harder in a rural area when you don't have other options. So if you have children that are kicked out of multiple centers, we don't have multiple centers to be kicked out of. You can't, and I have people that travel to Perry County to put their children in childcare because their county doesn't have it. And then they go back to their county and go to work. So the transportation is an issue. The cost is an issue. The availability is an issue. The staffing is an issue. Trying to get teachers in there starting at $10 an hour when you can go to a fast food place and make more and not have to change a dirty diaper. And so there are issues all around. And one of the biggest is trying to make payroll and have staff. Thank you.
So that is our presentation, but we would be happy to answer questions as well.
Senator Chambers Armstrong.
Thank you, Mr. Chair. Just a quick question, Dr. Vanover. I was curious what you were saying about ratios. I was recently at a conference where someone was relaying a conversation about raising ratios, teacher to children ratios in their state. And the question she put to folks was, how many babies can you carry in a fire, right? If there's a fire in the center, how many babies are you going to be able to get on the elevator and get out? But this just got me wondering, what are these ratios based on? Is there like some sort of scientific basis around like, this is the number that we can safely get out in a fire, or how are these things set?
So there are recommendations that what I like to call the health and safety, gospel for children, basically in child care facilities, is written by the American Academy of Pediatrics. It's called Caring for Our Children. And they make recommendations. Higher accrediting bodies like the National Association for the Education of Young Children make recommendation. Ultimately, every state has the freedom to set their ratio, but they do have to be able to justify it to the feds. And we also have to report every death and near death that happens in child care. And so ratios, as they fluctuate, the more children one adult watches, the higher that death rate typically is. Now, if you look at Kentucky on the map, if you look at every state that surrounds us, West Virginia, Tennessee, Ohio, Indiana, Missouri, every state that touches us has better ratios. The only state in the U.S. that has the same or worse 2-year-old ratio than us is Texas. So it does depend. I mean, there are square footage requirements that say this building has this much usable square footage. You can't count the bathrooms and the kitchen and stuff. This is the space that is allowed, and the international building codes document, how many children can be in that space based on that. But then lowering the ratios has a lot to do with health and safety and how much time and investment. What you have to think of, though, is if you lower the ratio, say we take that 1 to 10 in a 2-year-old room and we balance it down to 1 to 8, which would relieve almost any teacher and any parent. That means two weekly tuitions that the center gives up. So that's $450 a week that they give up, and that additional income has to come from somewhere.
I can see it's a very tough, complicated, interconnected issue. Thank you, Mr. Chair.
Representative Baker.
Thank you, Mr. Chair. Sorry, Miss Collins, can you help us understand, what's your recommendation? You said that the pay's too low. There's the deserts, they don't have access to child care. How do we fix it?
Thank you so much for this question. Basing reimbursement rates on actual cost versus market rate. I know in Perry County we have the lowest reimbursement rate for CCAP. And our neighbors in Knott County have a higher rate than we do, and they have no child care. And if it's based on market rate, I don't understand that math.
Follow up, please. What's the reimbursement rate?
I believe it's $22 a day for infants. Is that the lowest in the state?
Every single county, 120 counties, has a different reimbursement rate because it's done on the market rate of programs in that area. And then it's different for infants, for toddlers, for preschool, and for school age, because everybody charges a different rate for that. The infant is the most expensive because you can have fewer babies in a room. And then the school age is obviously cheaper because most times it's part-time care. The state is required to do a market rate evaluation every 3 years by the federal government and find out what the average cost of care is in each county. You have to implement your subsidy system based on the market rate or an alternative based on the cost of care. Many states are moving to that alternative cost of care. When Senator Carroll mentioned New Mexico, they have the best cost of care reimbursement system in the U.S. right now. But their child care program, as Representative Elliott asked about who's funding this, their child care program is basically funded by oil money. Other states fund it on lottery money. There are different sources in almost every state, which I can give you information on. But that cost of care, it makes it more expensive because the actual cost is about 2.5 times what we're actually paying.
Mm-hmm. Yeah. I'm sorry, could I do one more follow-up? So, can you help me understand why taxpayers should be asked to subsidize a private business? That's what I'm really struggling with.
Ultimately, you're looking at the whole of the economy. And this is when I go to conferences now, I'm not just invited to go to education conferences. I'm invited to go to economic stability conferences and economic policy conferences. Because take the policy that we did, free childcare for childcare providers. Head Start says that the perfect ratio for preschool is 1 adult to 10 preschoolers. If I take that teacher who can watch 10 children, I pay for their child to be there, and so we've got 9 slots left. That's 9 more families that are in the workforce. I can tangibly look at that return on investment and say 9 more families are now in the workforce, 9 more families are contributing to income tax. We know that 9 more families are going to be autonomous. They are not going to have to rely on things like SNAP and TANF because they are at a point where they can be independent. They're making their own salaries. They're able to support their family and give them the freedom to make independent choices instead of relying on that government assistance. So in this particular case, it is an economic policy issue that affects businesses. I mean, I showed you that in the past 12 months, 46% of families have missed at least 3 work days. That's a loss in those businesses. And we've seen states like Louisiana who have done significant cost analysis on the lack of child care to their economic workforce, and it has a huge impact, over $1 billion that Louisiana loses per year because a steady child care infrastructure is not in place. So those are all reasons that this particular business system needs that additional support to benefit Kentucky at large in the economic community.
May I also respond?
Sure.
I think we can also view it from the other side of we're not giving money to a business. What we are doing is supporting families. And what we're doing is supporting the children that will become our workforce and that are going to enter our schools. And if we look at kindergarten readiness rates that have dropped around the state, and we look at 3rd grade reading levels, and we look at 8th grade math levels that lead into a formula on how many prison beds we need in the future, it's all a pipeline for us becoming a society or a state that supports families. And it's not that we're giving money to a for-profit business, it's that we're investing in our children.
I think there are much better ways to invest in children and families, so I have to disagree with you, but I appreciate the response.
Thank you.
I would love to have an offline conversation with you. Okay. If we pass Amendment 2 and we start investing money in private schools with school choice, explain to me what the difference is. The parents of these kids are not taxpayers. This is early childhood education. 90% of the brain development by 5 years. Okay, very good. Thank you. We're going to need to hurry. We've still got another presentation. Senator Webb.
Thank you, Mr. Chairman. First of all, I'd like to congratulate Kristen on taking over for Jerry Roll. If y'all been here a while, you know that Jerry was a regular here battling for Appalachia, and you've got big shoes to fill, but you're doing it. So
thank you.
And I know her family very well, multi-generational, and their commitment to East Kentucky and the families that live there. So I appreciate that. And I think it's important you talked about workforce. I serve on the Workforce Development Task Force as well, and child care is one of the number one issues. And when you look at East Kentucky, I lived in Hazard. You look at still practice there some, Knott County and other areas. We're trying to diversify an economy there that used to be the driver of the state economy in energy and taxation and coal severance. We're trying to diversify that economy. We can't diversify the economy, attract business or anything else unless we can accommodate the workforce. We're going to keep losing people. There's not going to be, and then you got the demographic and poverty, which is well known after the exodus of a lot of people that have had to leave to work because of the loss of the coal industry and other incidental industries. So you talk about workforce and building the tax base back and letting that area become a driver again. And I'm glad we talked about the reimbursement rate scenario because that's a factor, okay? But it's not going to solve everything. Representative Baker had good questions. How do we fix it? Reimbursement rate is a portion of it. And I, too, struggle with a full subsidy. But how can we incent people to go into the business of child care? We've had 2 open in Carter County in the last couple of years, and that's great. And, what can we use as models or incent? We incent private business all the time in economic development. We give tax breaks and cuts and breaks all the time, and we pick and choose. The economic cabinet does that, and thank God for it. And as a taxpayer, I don't mind that because we are competing with other states who do more than we do a lot of times. So I can draw that, I can argue that point. But, I appreciate the conversation going on how we reach the deserts, because those deserts are going to remain. And that, like you said, whether it's crime, which studies show, and I'm also on the Justice Budget Subcommittee, I don't want to build any more prisons. There are models out there that work. So I think you can't quantify those costs all the time budgetarily in black and white, but you can from a fiscal standpoint in the long run, and certainly from a humanitarian standpoint. So I'm willing to work with a balance, and I appreciate you all being here.
Thank you.
Senator Mays Bledsoe, last word.
Thank you, Chairman. I'll be very quick. Thank you, Sarah, for your personal testimony as well as your professional one. I have a constituent who's a young widow, unexpectedly with 2 kids. One's a sensory seeker and impulsive. That environment in under 5 is hard, and was also removed from a situation like that because they just didn't have the capacity to handle it. Mm-hmm. Do you have any models or other states are doing anything in the disability space like that from a collaboration? Is it better to partner some of those groups of kids together where you have that, maybe enough volume to make that work? I'm just curious if you've seen either national models in that space.
This is an area I've done a lot of research. Usually you're inspired by life experience. So this one for me, knowing that my child was a child who ran when he got scared, and that teachers would have to chase him out the door, or he had to start wearing a GPS clip to school. There's so many things that when you have a child with special needs, others don't think about what your daily life is like. And I can't tell you how many of you on this committee have actually called me when I was at DCC or after and said, I have a constituent who has a child with a disability that's been kicked out of a child care program. Is that an ADA violation? What is it? It's not an ADA violation. It's them saying, I don't have the resources. We have nothing against the fact that your child has a disability. We can't support them. We want an inclusive model where kids with and without disabilities are in the same center, because if you have teachers who have a classroom of nothing but kids with disabilities, that's overwhelming. But we do have states that are doing things well. Right now, Wyoming is one of the states that is looking at every way they possibly can to improve the quality of inclusive childcare in their states for kids with disability. We have states like Georgia who pay the full amount of CCAP for kids who have a disability, because of the fact that centers that can support them usually cost more. And if we reimburse right now at the 75th percentile, that means we pay the full amount for 75% of centers, but 25% have an overage. And I guarantee you that those 25% with the overage are the ones who really make accommodations for children with disabilities. And so there are different models that we can look at. One of the biggest, though, is that we've got to train our teachers. We really need for them to have special education training, because we're seeing teachers leaving the field specifically stating that I didn't feel prepared to do my job. And childcare is very different than the K through 12 school system as far as requirements. But if you know you've got 15 hours of training a year, we need to make sure that some of that goes to how to support those challenging behaviors and disabilities instead of letting people take 15 hours of art training.
Okay. We're going to need to stop there, please. Sarah, thank you for being here today. And Kristen, appreciate all that you do in your area. The final presentation will be Dr. Charles All with his executive director, Kentucky Chamber of Commerce, and Ashley Butler, Mariah Levinson. And they're here to answer the question, where do we go next? And some pretty exciting news with what they're pulling together, and hopefully it's going to answer a lot of questions and kind of unify and set a unified direction for the next steps. Please introduce yourselves for the record, and you have the floor.
Sure. Charles All, Executive Director of the Kentucky Chamber Center for Policy and Research.
Ashley Novak Butler, the Executive Director of the Lift a Life Novak Family Foundation.
Mariah Levison, I'm the CEO of Convergence Center for Policy Resolution.
Well, thank you, Chairman. Thank you, members of this committee, for inviting us to have this conversation today. I know it's been a long meeting. We'll try to move efficiently and quickly to try to give you some good information and hopefully have some brief discussion before we adjourn. This is an exciting new project, though, that has been several months, if not over a year in the making, as we've been thinking about this issue. So we want to tell you a little bit about the project, tell you what we're doing. We have all of the partners involved in this project here at the table, so we can kind of give you a really bird's eye perspective of what we're doing. I want to start, though, with a little bit of background, and first just thank this body for a lot of the work that you have done to support this issue over the past several years. You have really put Kentucky on the map in terms of innovation and new approaches to getting at this challenge with, innovations such as the Employee Child Care Assistance Partnership, supporting the child care workforce. We've built one of the strongest subsidy programs in the nation for low-income working families. We have soon to come online the Innovations in Early Childhood Delivery Program. And then we are also seeing an emergence of local and regional efforts. And this is capturing the attention of the nation. We see this not only in news headlines, but when we travel around the country for various opportunities, we get questions about what is Kentucky doing? What's going on over there? We're really interested to see what you all are up to. With that being said, we obviously still have a number of different challenges that we're facing, and we could talk about all these in detail. We've heard a lot about these today. One of the ones nearest and dearest to my heart are the labor market challenges that we continue to see in Kentucky. Our current workforce participation rate is about 57.7%, which is now 5 points below the national average. We know that access to high-quality childcare is one of those things that is throttling the ability of adults to participate in the labor market. Determining exactly how much that is something we're digging into. But to give you a sense of scale, this could be affecting up to 110,000 prime-age working adults. That is a very, very large number, and if we could get even 50% of that, we could completely change the trajectory of our workforce participation problem. We also know that this is affecting things such as kindergarten readiness. Our kids are showing up to kindergarten not well prepared. And then the cost on families is really crushing for some of these folks. When some counties in Kentucky, we are seeing, according to the U.S. Department of Labor data, 21% of median family income for one infant child is going towards childcare. That's rivaling housing cost even. So this is a very, very significant challenge. So what's stopping us from making more progress and figuring out this question? We see a couple of different things. And this is in conversation with numerous stakeholders, conversations with legislators, conversations with our partners. First and foremost, we're missing a shared long-range vision. What do we want this early childhood ecosystem to look like 20 years from now? I imagine if we surveyed this committee, we would get a multitude of different perspectives and different answers. If we talk to the folks behind me, we would get even more answers. Similarly, we have a lack of consensus around very important questions. What's the proper role of government? What's the proper role of the private sector, philanthropy, in helping increase access to high-quality childcare? How do we even define high-quality childcare? What do we even call this thing? Is it childcare? Is it daycare? Is it early childhood education? Is it early learning? A multitude of different terms come up. How can we most effectively support and grow the childcare workforce? And when we talk about limited public and private resources, how can we most effectively leverage those to optimize impact? We need to answer these questions. We need to have these big conversations. Our approach to this is to build that consensus and build that vision. And the way that we're doing it is we've put together a very large and diverse stakeholder group. And we'll talk a little more about this stakeholder group here in a minute. But it is a very, very large group made up of Kentuckians from a number of different lived experiences and from all over the state. And we're going to be working with this stakeholder group over the next several months to work through some of these big questions. The twist with this project, though, and to make sure it's not just another work group, not just another stakeholder group, is that we are equipping them with professional support. And that's really where our partners at the table here come in today. We're providing them with professional facilitation support. We also have folks like Ashley sitting here next to me who's gone through this process in Jefferson County where they've had similar big conversations. But we're going to work together with this big stakeholder group. Our partners at Convergence will be facilitating this conversation. And the way this is going to work is August through October. We've already started this where we're talking with all these stakeholders individually. We're going to be holding our first official in-person meeting of this stakeholder group tomorrow in a series of meetings. We're going to have a 2-day retreat on Thursday and Friday where we're going to bring all these folks together in a room. And then February or March, we're hoping to have a blueprint for action report that will tell you, here's what this group talked about, here's the consensus that they reached, here's the framework, the concepts that we're talking about where we can truly increase access to high quality childcare. And then March, December, you can all expect you'll be hearing a whole lot from us about the contents of that report and what we want to do, because that's when we'll move into intensive advocacy for that issue. To give you a little more sense of who's involved in this project, I want to now turn it over to Ashley with Lift to Life and talk a little bit about her organization, and then we'll hear from Mariah at Convergence.
Thank you, Charles. Thank you for giving me the opportunity to speak to you today. Lift to Life Foundation is a private family foundation created and funded by David Novak, the founder of Yum Brands, that's KFC, Taco Bell, and Pizza Hut, and his wife, Wendy. Full disclosure, I'm the daughter, so I run our foundation. We provide funding to nonprofit organizations within the state of Kentucky, and our primary focus is in Louisville and surrounding counties. We target our funding to the focus areas of food insecurity, military family support, juvenile diabetes, and early childhood education. That's why I'm here today. There are 2 reasons we prioritize early childhood education. First, dollars spent on early childhood education have an incredible return on investment from a philanthropic perspective. Research proves that point and continues to do so. Second, it's very personal. 14 years ago, I moved back to Louisville from Chicago to build our family foundation. I moved home with a 2-year-old daughter, and I was pregnant with my second. And I wanted to continue my career. I was looking for childcare, and I became fascinated with early childhood development and understanding the childcare options available in Louisville for my young family. I became curious about how we can make investments that provide access to high-quality childcare for all young families in our community, not just those who could afford it. Our board holds the belief that supporting young families and their children sets up a pathway for educational success and workforce engagement, which is critical to the success of Kentucky. I have the privilege of working with many nonprofit partners and child care center directors who specialize in early childhood education field, and I continue to be amazed at the impact they have day on day out with these families and our youngest citizens. So what I'm excited to talk to you about today is an initiative that's taking place in Jefferson County, and we're really proud to support this. It's called Thrive by 5 Louisville. And Thrive by 5 Louisville has come together to identify childcare as a critical priority, leading to the creation of this new independent nonprofit organization. Our goal is to expand access to quality childcare for 3- and 4-year-olds in Louisville. First, I want to sincerely thank all of you for including Thrive by 5 Louisville in the current state budget and for supporting this vital work. Your commitment and investment has allowed us to leverage an additional local funding totaling $5 million from the city of Louisville. This support also helped us secure philanthropic and corporate contributions from our community. As the inaugural board chair, which is a role I've taken, I'm leading efforts to establish this independent nonprofit, including building the team that will execute our vision. We are laser focused on strengthening existing childcare providers by helping to attract and retain childcare professionals, improving childcare facilities, and eventually providing financial assistance to families who qualify. Our work is designed to enhance the entire childcare ecosystem, supporting nonprofit and private providers alike, including family childcare homes and faith-based centers. This initiative operates independent of JCPS and Head Start. We aim to empower families by giving them access to high-quality early learning options, while also helping them stay connected to the workforce. I'm eager to return in the future to share how this model can be replicated in your districts. Looking ahead, I'm excited to engage in statewide conversations that raise awareness and invite collaboration on childcare issues. Organizations like Lift to Life and Thrive by 5 Louisville are dedicated to increasing access to quality childcare for Kentucky families. And I encourage you to continue to be involved and supportive. Together we can create solutions, I really believe this, that truly benefit our working families and our children. Thank you for your time, and I'll now introduce Mariah with Convergence.
Thank you, Ashley and Charles, Mr. Chairman, committee members. My name is Mariah Levison. I run an organization called Convergence, which is a leading organization that works to bridge divides on critical issues through an approach called collaborative problem solving across ideological, political, and cultural divides. We bring together a really wide range of individuals, experts, people with lived experience, doers, many of whom never thought they could sit together in the same room to build relationships, to identify breakthrough consensus solutions, and to form unlikely alliances for constructive change on seemingly intractable issues. So we apply this methodology to a very wide range of issues. Our expertise is around how to build these relationships and these consensus solutions more than on any particular issue. Though we do focus on a handful of issues, including economic opportunity, which is relevant here, as well as some other issues around healthcare, well-being. But we really bring this expertise on how to bring people together. And so there's a couple things that differentiate our approach. One is that we're really bringing the full range of people together, not just some people on the edge of the middle and some people who are on the other side of the edge of the middle, but really the full range of perspectives, because our experience in doing this work for a long time, and it's what I've spent my whole career doing, is that when we do this hard work, we really do build wiser and more durable solutions, as I'm sure your committee does as you work through your different perspectives on these issues. One of the ways that we're able to attract this full range of perspectives to the table is that as an organization, we're a very fiercely nonpartisan, cross-partisan, bipartisan, whatever word you want to use, organization. We're entirely neutral on the solutions that groups develop. Our commitment is around helping these stakeholders come up with solutions that will meet more needs of more stakeholders on these critical issues. One of the things that I would highlight additionally about our approach is that we are really about going beyond compromising principles or values, of which there are very many shared principles and valuables on these issues that you've heard all of the wonderful speakers today highlight around a thriving economy, safe and healthy places for children, the future workforce. And those are things that are shared goals and shared values. And we work with stakeholders to really uncover what are the wide variety of underlying needs and interests that need to be addressed to come up with these creative, higher ground types of solutions. The last thing that I'll highlight about our approach is that we aren't a think tank. Our goal is not to come up with a report that sits on a shelf getting dusty, but to develop the relationships among a group of people who will then work to see their areas of agreement implemented to make positive changes. And this last slide is just a quick summary of our methodology that highlights that, again, we spend a good amount of time really making sure that we have the full range of backgrounds and perspectives in the room, and the Chamber and the Novak Family Foundation have been wonderful partners in doing that. And then we spend more time than average on, again, spending time helping people really understand all of the complexities of these issues and the complexities of each other and each other's perspectives in order to be able to identify these breakthrough consensus solutions. So we look forward to engaging with you during this process and sharing what the group comes up with you. Thank you for your interest.
I mentioned the key part of this element is, of course, the stakeholder group. And this is where we have spent a tremendous amount of time making sure that we bring together truly a diversity of perspectives, different ideological viewpoints, and also different layers of expertise. And so you can see the list of participating organizations that are part of this process. And I want to be clear, these are folks that have agreed to participate in the process. We haven't produced anything yet. There's nothing that's been agreed on. These are the folks that are going to be rolling up their sleeves, having these really difficult conversations. And we wanted to make sure that we had folks from all across the state, folks who engage in advocacy around this issue, but also folks who can talk to specific components of this conversation, like tax, for example, the human resources component to it, the early learning component to it, anything that we could think of. We wanted to make sure that we truly had a well-structured stakeholder group. And this is the group that will be meeting starting tomorrow officially. And we'll be working our way together over the next several months with Mariah and Ashley helping guide this process. And we're really excited to bring these folks together for the first time in person tomorrow. I want to close by talking about where you all fit into all of this. We will need your help throughout the course of this project. We will need routine and regular legislative feedback and perspective as we have these conversations. We want to hear your thoughts. You can anticipate we will be bringing questions to you that have come up in the course of these conversations, and we want to hear your responses. We also encourage you to reach out to these stakeholders independently when you feel necessary, to tell them, here's your thought on this type of issue or whatever it might be. We also anticipate we're going to run into roadblocks. We're going to encounter impasses, and that's a great place where legislative feedback and your all's leadership will be absolutely critical. So we've been engaging with Chairman Carroll, Chair Heverin as well on these conversations already, but we certainly invite all of you to engage with us throughout the course of this process. And with that, we will close up here, and happy to take any questions about this project.
Representative Dietz.
Thank you, Chair. And thank you, Dr. All. I think you hit the nail on the head for me at the very beginning in your first slide. And for me going forward to process all of this, it seems like an information dump, right, that we've got today. Are we talking about early childhood care that you may need for a baby, a 1-year-old, 2-year-old? Are we talking about or, a 3 to 4-year-old? It seems like, for me, the way I'm thinking about it, it's so different what those needs are. So I think for me moving forward, to be able to have clarity on how I feel about any of this, and as a long time ago, my children were in daycare because I continued to work, and I think it had a negative financial impact on us because as a young attorney, I probably lost money having my kids in childcare. There was long-term growth as your career moves forward by having them in there. But for today, I feel like I really need to know which path are we on. Are we going to focus on early childhood education and that 3 to 4-year-old, or are we talking about childcare and workforce? And today it felt like it's a big combination of all of it, and I think maybe that's where we're all confused. So for me, I'd like to see clearer pathways. But I think you hit the nail on the head in your first, I think it was the first slide, when you said, how do we define this? Thank you.
Thank you.
I think there are perhaps different philosophies when it comes to early childhood, I'm certainly no expert, nor do I claim to be. I've got 2 kids. I've led a center for almost 15 years now. That learning process starts in our infant room. So to separate the two, I don't know that works, because it is a foundation that builds on every year as you go forward. We've heard all the data, and we're always making decisions. We want proof. We want data. We know the brain's growth. We know what happens in those first 5 years. And to not maximize the educational component to the greatest capacity we can in those 5 years is not, it's an injustice to our kids. And my question always is, if we were to do that, and we were to invest, we were to improve quality, we were to treat it for what it is, education, what are the dividends going to be K through 12? How much further advanced are these kids going to be when they start kindergarten? And I'm talking center-based, I'm talking home-based, I'm talking parents taking care of their own kids at home, but providing them with resources to help them along that way. What would the dividends be on up from that? And that's separating the workforce issue completely. But that's kind of the perspective that I look at, because I see it every day. And I see the difference, and I get comments from kindergarten teachers that tell us how much better prepared our kids are when they get to the schools. We're 39th in the country right now, K through 12. That's our ranking. How much of an impact could we have on that if we focused on early childhood education and we invested in that like we do K through 12? 60% almost of our budget, general fund budget, goes to education. Is it not education? It is. I see it every day. There are curriculums that the centers utilize. There's testing. It's education. There is no difference. And I don't mean to be rude to anyone. I'm just passionate about this because I live it. And the dividends for the investment I think will be unimaginable. And if we don't do it, we're going to get left behind, because I assure you, these other states are doing it. So we need to be cognizant of that too, where we fall in that. But personal perspective on that, just from experience. Any other questions from members? Senator Meredith.
Thank you, Chairman Carroll. And follow up on your comments. Should be common sense for us, but unfortunately, the job that we do, every time we pass a law or pass a measure, there's unintended consequences. There's winners and losers, and I think that's where it starts to fall apart. So one thing that I would encourage you to do is adopt as a guiding principle that whatever we do has to be a symbiotic relationship for all the parties involved. And it can be if we're willing to identify those and understand it's a give and take proposition for everyone. But we don't do that, particularly in the economic sphere. Because traditionally, we're just wired that to grow our business, I take your business. And we've got to get beyond that. You know, it's that theory of economic equilibrium where if we make the pie bigger, everybody can win. But everybody has to be a winner, and it can be done. But very encouraged by this. I think the more people bring to the table, the more resources we had, the more draw upon. But again, I would just hope and pray that a guiding principle be it's got to be a symbiotic relationship. Thank you.
And if I could respond very briefly, Chairman,
Absolutely.
Senator Mara, thank you for that comment, and I 100% agree with you. And I think a big part of the challenge that we've seen so far is that conversations around this issue, they tend to happen in silos. And I think that's exactly how you end up with a lot of these unintended consequences. And so our hope is that by bringing together a group that's as big as this one, we have about 37 participants so far. That may grow because we want to make sure that we are capturing all these perspectives to avoid the very thing that you mentioned. And finally, Representative Dietz, if I could just circle back to your comments at the start, you're not alone, I think, in how you feel. This is something that we have heard from multiple of your legislative colleagues where they do feel like they understand there's a problem, but they're being presented with about 50 different options on how to proceed forward. That's a very difficult place for you all to navigate. And so one of the goals of this project is to streamline those options and to present you all with something where you can be confident that this has broad stakeholder input and consensus around it. So we are hoping that that would be the end result of this.
And from my perspective as co-chair of this committee, I'm open to options. I just want to see us solve this problem and do what's best for our kids, and I think we do have to consider that. In all the years we've been addressing this, no one's brought an option that didn't involve us investing in our kids. I wish there were a way. Maybe there's different ways to structure it. I'm okay with looking at anything that solves the problem, but workforce, education, those are priorities in our state, and it starts from the moment of birth. And so I'm excited about what you all are doing, and you know, the legislation that we brought forward last year in the Horizons Act, we've had working groups, we've had numerous discussions. That was a big ask, and I'm extremely aware of that. And the financial ask, I never expected that we would get that. It was a start, something to start the conversation. Some of the decisions that we did make and that was included in the budget, those are having some positive impacts on the centers, even financially. It's not significant, but it is. It does make a difference. When you've got teachers that are getting child care assistance, teachers, most centers usually give them free child care or a discount. So that's extra revenue for a center. So those things have helped to an extent. And I don't think there's any center out there. Nobody goes in to child care, whether it be home or center-based, with an idea that they're going to get rich off of it. That's not why they do it. They just want to be able to survive, and we want to be able to provide quality services. I've been there the days when a center was just nothing but babysitting to where we are now. And folks, we've come a long way. And it takes a lot of work, and it's a different world today from COVID. The behavioral issues that Dr. Vanover spoke about, I can't express enough how bad that is and the struggles that centers have. Had the conversation yesterday. Sometimes you have to choose between a kid or a teacher. That's the reality of it that we're facing. So all of those things come into play, and there are so many different layers of this, but I think the systematic approach that you all are taking, where I thought maybe there was more unification last year than what there really was, I think there was a lot of fragments, and I think this body, both chambers were getting a lot of different stories on what they think should happen, a lot of different requests, but this is the logical next step, and I look for this to be productive. I'm excited about it, and if this group comes up with better options, I'm ready to listen and I'm ready to fight for that. We've got to do something, and we've got to do it soon. That's just kind of my thoughts on it. Anybody else have any closing thoughts or comments on this? Okay. Thank you all so much for being here. Appreciate all your efforts, and looking forward to things to come from this group. And would ask members of this committee, please participate in this process as much as you can. I think it will make a huge difference. The next meeting of this committee will be on Monday, November 18th, 2024 at 1 p.m. in this room. Can I have a motion to adjourn?